The tragic death of a young father who died of a tooth infection recently made national headlines and highlighting just how dangerous tooth infections can be. Dr. Brian Laskin, founder of Lake Minnetonka Dental, is here to talk about the causes and what you shouldn't be ignoring. Welcome. It's good to have you here today.
Thank you very much for having me.
What does cause a dental infection?
Well, dental infections can be caused by many things, but typically it's a bacterial infection that can be caused by cavities, gum disease, even trauma.
In the extreme death, what are other manifestations? So how do these things present themselves?
Well, the bacteria could actually cause, most commonly it's when the bacteria cause swelling in the floor of the mouth that actually can close off your airway, but in this unfortunate incident, the bacteria actually traveled to his lungs and caused a lung infection.
So these infections are virulent, strong enough that they can travel to other organs and then you're compromised.
Exactly. People have to understand that infections anywhere can be risky, and especially even in your mouth, because the bacteria that are actually quite noxious and they can enter your bloodstream and go anywhere in your body.
Does this happen at any age? Or
it can.
Age?
It can. In fact, it happens unfortunately quite often in kids as a percentage of deaths due to dental infections. Luckily, it's not very common. Even though dental infections are common, deaths are fairly rare.
When we have a dental exam, I go twice a year, and the tongue is pulled out to inspect it. What are you looking for in there exactly?
Well, particularly when you're looking at the side of the tongue, that's the most common spot for oral cancer. So that's one more reason, in addition to bacteria that can cause dental infections that go elsewhere in your body, to see your dentist regularly.
What can be done to prevent any of this from happening? What should you do?
Well, keeping your mouth clean, so brushing twice a day for a full 2 minutes. If you've never timed yourself, it's probably a good idea, or else to use an electric toothbrush. Flossing, and then seeing your dentist regularly, and then also avoiding things that are sticky and acidic, like caramels and gums and sodas.
I'm sure there are some people watching today who are saying, what should I look out for symptoms? Help us and walk through that if you would, please.
Well, sure, yeah. Common signs and symptoms of dental infections are pain, swelling, bleeding, but unfortunately most dental infections aren't noticed by patients, so that's one of the reasons why it's important to see your dentist regularly and get regular exams and x-rays.
It's the old brush, obviously, as you said, twice a day, doing that is very important. And you are one who believes in flossing as well?
I am, yes. Yes, even though it's not very commonly followed by people, flossing as much as you can, it is a very effective way of removing bacteria.
It is a good thing, isn't it?
Yep.
And I know if it helps with breath as well.
Exactly.
It's a good thing. Thank you for being here today.
Thank you very much.
Good information. We have posted additional info for you at KARE11.com. Look into the shows tab and the news at 4.